This is high time. This is high time to have technocrats over bureaucrats. Hello everyone, welcome back to my channel. This is Dr. Maha and you are watching Versatile Maha. So guys, today's topic is a little serious and sensitive as well. And today we are going to discuss about the mental health of healthcare workers. It's no surprise to us that how much the healthcare workers are going through, how much they have at stake while they treat these patients during this pandemic. So today we'll be discussing about 3 different types of healthcare workers going through different types of mental problems. Firstly, they are frontline warriors, right? The frontline healthcare workers who are posted in isolation wards, and what are they going through. Number 2, we'll discuss about healthcare workers who are posted in government hospitals, but they are not posted in isolation wards, but still there is a risk of being exposed. And number 3, we are talking about private practitioners who run their own nursing homes, their own setup, or their own hospital. So before we start with the video, don't forget to subscribe to my channel and hit the bell icon so that every time I post a new video, you get a notification. Let's start with number 1. Our healthcare workers, our frontline healthcare workers, our warriors who are fighting continuously, who are treating their patients, who are working with so much dedication. And if you guys must have come across this news that 2 healthcare workers in the USA had committed suicide. One was a physician, Dr. Lorna Breen, and other was a medical technician, Mr. John Mondello. So imagine the mental stress, the mental trauma, depression they are going through to such an extent that they had to commit suicide. And such young people they were. They had their life ahead of them. So it is important for people to acknowledge their hard work and continuously praise them, continuously boost their mental health, that they are doing really great. And I mean, these doctors, they've been trained to deal with such stress, deal with all this, but again, so many deaths, so much to go through in such a short span of time, it takes a lot. And here in India, like, if doctors are being posted, who are being posted in isolation wards, most of the hospitals have this routine of 14 days on duty and 14 days they get to take some rest. And in some hospitals it is 7 days on and 7 days off, right? So in that condition and during that time, while they get to rest, and unfortunately the doctors, they do not get to meet their families, their loved ones, because again, they do not want to put them at risk. So when they get to take rest for like 14 days, for instance, so during that period of time, it is important for the healthcare workers to talk to each other, to talk to their loved ones, video call them, and just meditation, practice yoga, do meditation, make a fixed routine that at this point of time we'll sit together, we'll meditate. And again, if they need help, then they can definitely consult their psychiatrist, because keeping things inside and going through such a lot of mental stress, it takes a lot. So now let's come on to the second category, and that is the healthcare workers who work in a government hospital, but they are not in direct contact with the patients, they are not posted in the isolation wards. So these are the healthcare workers who go to their hospitals and they are exposed to the patients who are positive for COVID-19, and then again they come back to their homes and go straight away to the washroom, dump their clothes somewhere and take a shower, and then they get to talk to their families. And again, there's always this risk they have in their minds. They have the stress that they might affect their children or their family or their wife, whatever. So again, it's a different kind of stress in their minds, and these are the stress which keep piling up on, and it is difficult for everyone at this point of time. So what exactly is stress? Stress is nothing but our own thoughts, right? I mean, stress is within us, and it is very easily, if we are strong here, we need to be strong, and we just need to accept the fact, okay, we are in a situation and you cannot turn a blind eye towards it. You are in a particular situation and you'll have to face it, right? So there's no point of stressing about it. If we should, the outlook which a person should have is that okay, fine, I am in the situation and I have my faith and things will be fine. That's it. Just keeping a positive attitude will help a lot at this point of time, because it is what it is, right? And there's nothing you can do about it, even if you're stressing. So why not just put a smile on your face and be positive from within? Again, same, practice meditation, yoga, and make if you're with a family, make a routine that okay, this is the time, at this point of time all of us will sit together, we'll practice yoga, we'll meditate, and you can play family games, indoor games, and there's so much we can do if we want to do, right? So this was for our healthcare workers. So let's talk about the third category of so let's come on to our third category, and those are private practitioners. So let me tell you guys as to what is happening with private practitioners. They are going through a different kind of stress, and it is a big stress to them as well. Now what exactly is happening is that the private hospitals do not have testing for COVID-19. They cannot do testing for COVID-19 actually, and there's no particular aid from the government to the private hospitals, and it becomes a very costly affair, ordering so many PPE kits for different staff. And every private nursing home, at least on an average, they have around 20 to 25 staff. So PPE kit for every one of them, no government aid, and on top of it all, it is the order of the government that the private hospitals cannot refuse any emergencies. So that is fine. Being doctors, we are happily accepting emergencies, and that is our duty. Doctors are ready to do that. But the problem is, for instance, if a patient comes in an emergency and the patient requires a surgery, and patient is undergoing an emergency operation, but then what happened later on, we find that the patient turns out to be COVID positive. Now this is happening, this is actually happening. The current scenario is when the patient is found positive in a private hospital, the hospital is sealed. Fine, the hospital is sealed. On top of that, the private hospitals are being called as corona spreaders, like it is the private hospitals which are spreading coronavirus. And apart from that, the FIR is launched against the doctor whose hospital or nursing home that is. And on top of that, the hospital staff is being tested for COVID-19 and are kept in isolation. And guess what? Who's paying for the isolation, and who's paying for their staff getting tested? Of course, the doctor. No aid, no nothing. So that is the problem. This is big stress. This is a big stress for all the private practitioners. They are worried as to whom should they admit, whom should they not. But being doctors, they cannot run away from their duties, and they have to admit patients. And this is happening. Hospitals are being sealed. Now this is the problem. The rules are made by the bureaucrats, and they are from non-medical background. So I would like to raise a question that when we have IAS, we have IES, we have engineering services, we have economic services, then why can't we have Indian medical services? It is my question to everyone, and it is my request as well, that we being young doctors, we would want Indian medical services we would want Indian medical services to make rules for doctors, because they would know what to do and what not to, because being doctors, they know what is better for a doctor. It is my request to Indian Medical Association to raise their voice, and if they do not, I don't know why they are not raising their voice. Maybe because they've lived their life and they have lived their 40 to 50 decades happily, so maybe it's not of their interest anymore. But to young doctors like us, all Junior Doctors Association, it is my request to them to raise their voice, and we should request the government to bring in Indian medical services. This is high time. This is high time to have technocrats over bureaucrats. So that was all I wanted to say. I hope you guys listen to this. I hope you guys spread this message to everyone, so that we together could bring a change in law, and we together could bring Indian medical services in our system. So that was it, and in the end, it is my humble request to everyone to support our healthcare workers. They are fighting for us. It is a war-like condition, and our healthcare workers are in war, and they are fighting for us, just like the army. So it is to every man, to every common man, every person should respect and support doctors rather than accusing them of spreading coronavirus. So guys, we are all in this together, and to all the healthcare workers, we are with you, we are there for you. Stay strong, stay positive, and fight like a warrior. That's it from my side, guys. Take care, you all. Bye the bye.